I'm Dr. Aparna Jaswal, Director Cardiology and Department of Electrophysiology at Fortis Escorts Heart Institute, Okhla, New Delhi. Today I would like to share with you a small discussion about sudden cardiac arrest and sudden cardiac death. This is an occurrence which is one of the most unfortunate occurrences in medical science, especially when it targets the young. Something which is really fresh to our memory is those of us who have watched the football in the recent times. What happened last month in the Euro football to the captain of the Denmark team. We were witnessing the match when the young man lay on the floor, nearly dead, and what he had was sudden cardiac arrest. Thankfully, medical team attended to him immediately and he was saved. But such is not the case with the majority of people who succumb to sudden cardiac arrest and eventually die, and it is called as sudden cardiac death. So we must understand what is it that causes us as human race to succumb to this unfortunate occurrence of sudden cardiac arrest and subsequently to sudden cardiac death. The most common cause of this eventuality is because we have disease in the blood vessels of the heart, which is called coronary artery disease. So if we together want to prevent this from occurring, it is very simple. We must remember that we must target those diseases which are called the lifestyle diseases, such as hypertension, diabetes, obesity, sedentary lifestyle, quitting smoking, and moderate consumption of alcohol. If I were to tell you that it is very common, it is as much as 1 out of 1,000 adults globally succumb every year to sudden cardiac death. Now that would amount to a very big number. Together we must understand that those of us who are adults and have lifestyle diseases must look after ourselves very well. If you make sure that your blood pressure is well under control, your diabetes is well under control, your cholesterol is well treated, you are active and exercise every day, you quit smoking, and you do not take much of alcohol, if you do follow these few principles of life, you can protect yourself from this deadly occurrence of sudden cardiac arrest. Those of you who already have heart disease and have poor pumping of the heart, as we quantify it on an echocardiogram as ejection fraction, must understand that you should discuss with your cardiologist that you may need a device which is called an implantable cardioverter defibrillator. Those patients who already have heart disease, have poor pumping ability of the heart, must discuss, because it is this device which is truly a medical marvel and can protect you from the occurrence of sudden cardiac death. We must remember, there are uncommon occurrences in individuals who do not have coronary artery disease yet may succumb to sudden cardiac death. Not to spend time on that, but to understand the most common occurrence of sudden cardiac arrest is coronary artery disease, and together we must protect ourselves from the occurrence of coronary artery disease as well as this unfortunate occurrence by simple tips that I told you. Protect yourself from lifestyle diseases and you could keep yourself away from the occurrence of sudden cardiac arrest. Thank you.